At the University of Maryland School of Nursing, in collaboration with our Gambian colleagues, we are training health professionals and research scholars to conduct research with high ethical standards, scientific rigor, to address the urgent health needs in the Gambia, such as HIV, cardiovascular and respiratory diseases, cancer, COVID. This work strengthens global health systems as well as human capacity to protect all of us. We have two programs that we are implementing to address these issues. One of them is the postgraduate certificate program in research ethics and methodology, and a master's program in bioethics. The second one is we implemented a structured mentoring program with our collaborators in Nigeria and Ghana. The Ministry of Health most recently actually selected some of our trainees to be part of the drafting of a national ethics framework. We have one who has been selected to be a research intern in environmental ethics with the Africa Bioethics Network. And we have another one, and these are the folks that just graduated. We have another scholar who was accepted into a PhD program through the Carnegie Scholarship Support. So these folks are taking the leadership role in terms of addressing the important priorities in Gambia, and in turn they are really making the impact in terms of their leadership positions through their expertise in research ethics. It's very important to understand that Congress would not have appropriated funds for global health research and education if it wasn't for in the interest of the American people. As the representative Tom Cole once noted, I'd rather fight Ebola in West Africa than in West Dallas. That statement is telling because it reminds us that we should contain diseases where they originate. And second of all, it also reminds us that borders are fluid and we live in an ever interconnected world. Take COVID-19, for example. We know that we had people coming into the US and infected other people, transmitting it around the country. So one of the things that Fogarty does, which is very important, is that they are funding these countries so that they can build the capacity. And these researchers will then be able to identify these diseases early and respond promptly and effectively so that the epidemic would not become a pandemic and come to countries like the United States. If capacity development work is not taking place in other countries, we then open doors for diseases to cross borders, because then we haven't built the capacity in those other countries to be able to contain the disease as we talked about before. So we will have problems with diseases coming into the US easily. If we don't have this, all of these capacity development work, whether it's the human part or the infrastructure, will be limited, and of course open doors for other problems to occur. So we are mitigating these by the capacity development work we're doing through the funding from the Fogarty International Center at the National Institutes of Health.